Welcome to the Deep Dive. We're your shortcut to getting properly informed. We sift through the latest research, interesting articles, our own notes, and boil it all down for you. Today, we're plunging into something really vital, though maybe not always front-page news. The safety, the well-being, really, of healthcare workers. Now, patient safety gets a lot of attention, and rightly so, but the people providing that care, their safety is just as critical. It actually shapes the quality of care we all get. Our main source for this is a brand new systematic review just published in 2025 by Safa Elkefi and colleagues. It's called The Role of Participatory Ergonomics in Supporting the Safety of Healthcare Workers. So our mission today, to unpack this approach called Participatory Ergonomics, or PE. It's about how it's changing safety in healthcare and what it means for the folks on the front lines.
Yeah, it's so important to start there with the workers. Modern healthcare, it's not just a job, is it? It's incredibly high stakes. It's fast-paced, really complex. Hospitals are under constant pressure, tight deadlines, tough schedules, sometimes, critical staffing levels. And it's not just about being busy. Think about the physical load lifting patients, being on your feet for 12 hours straight. And then there's the psychological side, dealing with intense, often life and death situations daily. If you don't address that relentless pressure, it really eats away at the safety culture of an organization. So the well-being of these professionals, it's urgent, not just for them, but for the whole system.
Okay, so let's unpack that term you mentioned, participatory ergonomics, or PE. It sounds a bit technical, maybe, like something an engineer would talk about. What is it really, and why is it so important in healthcare?
That's a fair point about the name. You hear ergonomics, and maybe you think office chairs, right? Or keyboards. But PE in healthcare is much, much deeper. So Human Factors and Ergonomics, HFE, that's the broader science. It's all about optimizing how people and systems work together, making work systems better. Participatory ergonomics, PE, is a specific, well-established tradition within HFE. And the core idea, it involves the workers themselves. We're talking nurses, doctors, paramedics, lab techs, support staff, getting them involved in planning and controlling their own work. It's based on a simple but powerful idea. The people doing the job every day. They often have the best insights into how to make it safer, more efficient, and just more sustainable for them long term. The really core idea, the thing that makes it quite revolutionary sometimes, is empowerment. It's about ensuring the end users, the staff, aren't just told what the safety rules are. Instead, they have the knowledge and the actual influence to shape how things work, the processes, the outcomes. And PE looks at safety holistically. From the micro level, like individual tasks, using a specific tool, right up to the meso level, how teams interact, and even the macro level organizational culture, bigger system factors. It's comprehensive.
Right, so it's not just management deciding, okay, we need a new policy on lifting. It's about involving the actual people doing the lifting or managing the meds or whatever the task is, getting them involved in figuring out the problem and the solution. It's really human-centered design, isn't it? Making their jobs safer, yes, but also more efficient, less stressful, because they helped design the fix. That feels like a big shift for some places. Now, what really struck me about this review, and it looked at 36 different studies, was just how many different challenges PE can help with. It's not just one thing. Let's really dig into some of the main issues that came up in the research.
Absolutely. And the most common one, by far, it showed up in 14 of the studies, was musculoskeletal injuries, MSDs. These are incredibly common in healthcare. We're talking chronic back pain, shoulder strains, wrist problems. Often from things like handling patients, lifting, doing repetitive tasks over and over.
Yeah, I hear about that a lot. So what did the PD interventions look like for MSDs?
Well, they were often very practical, and the review found them effective. For instance, using patient handling devices, lifts, slings, that kind of thing. Studies showed these really did reduce the strain on nurses' shoulders and lower backs. And think about that, day after day. It makes a huge difference to preventing long-term injury, maybe even keeping people in the profession longer. Other things included structured programs, like the Ergonomics Program Implementation Continuum. They call it EPEC. It basically was a framework for ongoing ergonomic improvements. Also things like pre-work stretching programs, and even redesigning how things are done in morgues, at body collection points, to make handling less strenuous. It's surprisingly physical work.
But it's not just about having the right equipment or program, is it? You mentioned the human element. The review talked about acceptance rates being, well, mixed sometimes.
Exactly. That was fascinating. Context matters so much. Like, one U.S. study found really high acceptance. Only 10% of staff declined to participate in a PE program. But then some Japanese studies done during the height of COVID-19 showed more caution. Only about 44% of workplaces there were willing to adopt new health promotion strategies at that time.
Wow, that's a big difference.
It is. And it shows it's not just about the intervention itself. It highlights how things like the existing culture, how stressed people already are, the perceived urgency, all that influences whether these things actually get adopted. PE involves cultural change, too.
So beyond the specific muscle and joint issues, what about other types of injuries?
Right, 8 studies looked at broader occupational injuries. Again, PE interventions showed real promise. Tools like the Perform Risk Assessment tool that stands for Participative Ergonomics for manual tasks. This puts the power of risk assessment directly into the hands of frontline workers for their physical tasks. That, and the EPIC program again, were shown to reduce the risk, the severity, and just the overall rate of injuries from manual handling, and the common threads for success. 2 things consistently came up. 1, active, real involvement from frontline staff in spotting hazards and creating solutions. And 2, strong, visible support from management. You really need both for these things to stick.
Which brings us to the flip side, right? The review didn't shy away from the barriers. What makes PE hard to implement sometimes?
Yeah, it's crucial to be realistic. The review highlighted some persistent challenges, things like staff shortages and high turnover in CAR. It's hard to run programs when people are stretched thin or constantly changing. The existing safety culture, or sometimes the lack of one, can be a huge hurdle, just finding the time for staff to participate when they're already overloaded. And, unfortunately, communication breakdowns are still a common problem.
So even with good intentions and good ideas, those systemic issues can really get in the way.
They absolutely can. Which actually leads nicely into another area. The review looked at performance in complex systems. 7 studies focused on this. The thinking here is that inefficiency in healthcare isn't just about wasting time or resources. It can actually create safety risks. PE helps find those friction points across people, the organization, the technology, and smooth them out.
Can you give an example?
Sure. PE helped design better community-based care pathways, even when it was hard to get much time from stakeholders. It had tackled issues like nurses feeling they didn't have enough control or autonomy over managing medications in nursing homes, giving them more, say, improved things. And it was vital for building trust in surgical teams. That trust is essential for really effective pre-op briefings, where clear communication saves lives. There were also examples of culturally informed care, led by indigenous stakeholders, using PE principles to improve cultural safety alongside medical safety, making care respectful and appropriate.
You know, it's striking because issues like inefficiency, lack of trust, poor communication, you find those in lots of workplaces. But in healthcare, the stakes are just so much higher, aren't they? And inefficiency isn't just annoying, it could genuinely harm someone.
That's the critical difference.
Exactly.
And speaking of high stakes, 3 studies specifically looked at medication safety. Errors there can be catastrophic. PE helped in several ways, providing very specific training on medication therapy and management, including more of a systems thinking approach rather than blaming individuals, promoting better teamwork, like properly integrating clinical pharmacists into the process. And a really big outcome was improving staff's willingness to actually report errors. That shift from a blame culture to a learning culture is absolutely fundamental for preventing future mistakes.
That's huge, getting people comfortable reporting near misses or actual errors.
It really is. And interestingly, on the operational side, one finding was about staffing. Flexible staffing models were actually found to be less effective at reducing workload in dispensing pharmacies compared to having equivalent fixed staffing levels.
Oh.
Yeah, the fixed levels were better at preventing backlogs.
Huh.
It just shows how PE insights can touch on even high-level decisions like how you structure your staffing. It's not always intuitive.
And again, this points back to management, doesn't it? The review mentioned leadership actively collaborating and providing financial backing for these medication safety initiatives.
Absolutely essential. Their buy-in, their active support makes all the difference.
What about other areas, maybe less studied but still important? You mentioned stress and physical load earlier.
Right. Only 2 studies focused on each of these, so the evidence base is smaller here, but the findings are still significant. For occupational stress, PE tools like intervention mapping help design very specific, tailored solutions, things aimed at improving stability and well-being. Practical examples included installing better phone systems in clinics to cut down on communication hassles, or adding escorts for night shifts to improve safety and reduce anxiety for on-call staff. Small things maybe, but they target real stressors.
Things that actually make a difference to the daily grind.
Exactly. And for physical load, particularly looking at paramedics, PE helped get a much better handle on the significant physical demands of their job. It helped identify how those demands varied between busy city areas and more rural ones, allowing for more targeted injury prevention.
Yeah.
It also involved direct observation to really understand the tasks, not just relying on old job descriptions.
Even though fewer studies focused on stress and physical load in this review, they feel so central to the healthcare worker experience. It seems like a really important area for more PE work in the future, doesn't it?
I completely agree. It's fundamental. And connecting all these different threads, the big picture from this review is pretty clear. Safety in healthcare isn't just about the patient experience. It's deeply, fundamentally linked to the safety and the well-being of the providers themselves. And PE is emerging as a really effective strategic way to tackle this.
But it's important to be aware of the limitations too, right? You mentioned the studies were mostly from certain regions.
Yes, that's a key caveat. The vast majority of the studies came from high-income countries, mostly Europe and North America. So while the results are very promising, we need to be cautious about just assuming they'll apply everywhere. Implementing PE takes resources, time, money, trained people. That's a major challenge in lower resource settings. We definitely need more research looking at how PE can be adapted and implemented effectively in different global contexts. That's a critical next step.
So, thinking about making PE work more broadly, what are the key takeaways? What really makes it successful?
Well, the review really hammers home that it has to be a team effort. It needs both the employees on the ground and dedicated management. Management needs to show commitment. That means providing resources, setting clear goals that include safety and well-being, having supportive policies. But just as important is genuine employee involvement. When staff are actively engaged, their insights, their enthusiasm, their sense of ownership, that's what really drives success and makes it stick. It has to be a partnership.
And that sense of control, that ownership,
Hmm.
that sounds like it could directly combat burnout, which we know is a massive issue.
A huge issue, especially for nurses, but across the board, really. Burnout is driven by things like impossible workload, staff shortages, feeling powerless in difficult environments. PE directly addresses that feeling of powerlessness by giving workers a voice and control over improving their own work situation. The stats on burnout are genuinely alarming. You mentioned Canada earlier, 73% of physicians, 45% of nurses reporting severe burnout. Giving people agency through PE could be a powerful antidote.
And thinking about recent times, the COVID-19 pandemic obviously threw gasoline on that fire, increased workload, incredible stress.
Absolutely.
So PE feels like it could be a really valuable tool for recovery, for building resilience after the pandemic too, doesn't it? Engaging workers to reshape things based on what they learned.
Precisely. It's an opportunity to learn from that crisis, to involve staff in redesigning workspaces, workflows, processes, to make them more ergonomic, safer, and more sustainable for the long haul. Building back better, essentially.
And just to be fully transparent, the review itself noted its own limitations, didn't it? Something about quality assessment.
That's right. The authors were clear they didn't conduct a formal quality assessment or risk of bias analysis for each individual study they included. So the goal wasn't to say this specific finding is definitively proven beyond doubt. It was more about providing a comprehensive summary of the existing evidence as it stands today. And despite that limitation, it offers a really valuable overview. It clearly points to PE as a very promising strategy for improving healthcare worker health and safety. It sets the stage for future, perhaps more rigorous research.
Okay, so let's try and sum this up for everyone listening. This deep dive into the Elkefi review really shows that empowering healthcare workers through participatory ergonomics, it's not just a nice to have for the staff. It seems to directly improve patient care. It boosts efficiency. It makes the whole system stronger and more resilient. It sounds like a genuine win-win for everyone, providers, patients, the organization.
I think that's exactly right. Yes, there are challenges. Yes, there are gaps in the research, particularly geographically. But the overall evidence strongly supports PE. It's a strategic, human-centered way to build safer, more supportive, and ultimately more sustainable healthcare workplaces.
So here's something to think about. Imagine a healthcare system where every single person on the front lines, the doctors, the nurses, the techs, the porters, the cleaners, every single one felt truly heard. Imagine they actively participated in shaping their own work environment for safety, for efficiency. How might that fundamentally change the future of healthcare, not just for those providers, but for every single one of us who relies on their care? Thank you for joining us on this deep dive.